In response to new U.S. visa restrictions, discussions have begun in Jamaica about the likely impact on Cuba's medical mission program, particularly in relation to the nearly 440 Cuban healthcare workers in the country. Health Minister Dr. Christopher Tufton confirmed that the government is working closely with the Ministry of Foreign Affairs to assess the situation and will address it at the next cabinet meeting. On Tuesday, U.S. Secretary of State Marco Rubio announced the expansion of visa restrictions targeting Cuba's overseas medical program, which includes Cuban healthcare workers like those in Jamaica. These restrictions also apply to individuals linked to the Cuban government or labor export programs. The Jamaican government is now looking at the potential fallout and exploring alternatives. Dr. Jaslyn Salmon, former president of the Jamaica Red Cross, stressed the significance of the Cuban healthcare missions, which have positively impacted thousands of Jamaicans, particularly those who cannot afford costly eye surgeries. He called for a regional approach, suggesting that Caribbean nations, including Jamaica, should work together to address the issue with the U.S. government. Meanwhile, Guyana's Vice President Barrett Jagdeo indicated that CARICOM would push the U.S. to soften the sanctions due to their potential negative effects across the region. This new U.S. policy is a serious concern for Jamaica, where many poor citizens rely on Cuban healthcare workers for eye care and other essential services. The Cuban medical missions are often the only option for Jamaicans who cannot afford expensive private treatment. Every year, thousands of people look forward to free eye tests, surgeries, and care from Cuban doctors and nurses. The visa restrictions could disrupt these valuable services, leaving many without critical health care.